My name is Jason Langheier. I'm the CEO and founder of Zipongo. And as I pull the screen back up, I'm actually trying to walk the talk today. I'm actually doing this presentation from my treadmill desk. So if you hear a loud thud, you know what happened. And you can see the presentation here. I'm going to start with just the presentation on this side. We get going, and then I'll try to share my screen in a moment. So we make it easy to eat well, and our mission with Zipongo is really to overcome this challenge that you all know, which is that poor diet, physical activity, and tobacco use are top killers in the U.S. And at the same breath, you can prevent 80% of heart disease, 80% of diabetes, as you know, globally. And what's even more compelling is that more recently, the New England Journal published a paper on the Mediterranean diet saying that you could reduce cardiovascular disease deaths by 30%. So in light of that, the question is, how do you overcome environments like this? Barry Schwartz actually has one of the top 10 TED Talks of all time on the paradox of choice. And the challenge that consumers face when they go into a grocery store center aisle, for example, is that they tend to default back to the products that they already know. And as much as they're motivated for a short burst of time, and they might want to track their food, or they might want to use a barcode scanner to learn more about the nutrients, the fact remains that if you're unhealthy, then every time that you look at a nutrition label, there's even been fMRI studies that have shown that it makes you feel worse about yourself. And so it's hard to ask people to proactively address their health concerns by having to actively think about health all the time. Instead, you have to take people in their height of motivation and really use that energy and that motivation to shift people to different environments that they create for themselves that essentially protect themselves from the more stressed versions and worse versions of themselves later on. So as I move forward, the challenge with employee wellness and solutions that have been brought to large self-insured employers for many years now is that they put forward solutions that say things like daily use of your food log and meal planner is recommended. And yet they know in their data that most people stop using these after 1 day of use. And then a handful of the population will continue to use it, but that's not enough to actually make a change. And most organizations also put forward coaching. And for a few people, coaching makes a difference. But the variability of quality of coaching is high. It's not a great experience for the coach either. And it doesn't really fulfill the need. Because you can imagine, you get the call and you say, I'm here to help. And says, okay, great, eat more broccoli. As if you didn't already know that. The real challenge is, can you actually move behavior? And the good news is there's actually quite a few companies now that have started to get into couponing for healthy food, which can help move the needle for a subset of the population that's actually discount motivated. The challenge, of course, is that many of the companies that have come out to do this, they focus only on center store foods, like snack foods that are driven by CPG companies. And the data would show, from my background at Harvard School of Public Health and nutritional epidemiology, you can't actually change outcomes by shifting on snack foods. You can by shifting on things like produce and fresh meats and eggs. And the snack food shift can help, but it's not enough to make a difference on its own. So the danger is checking the box on what we now know is the single most important thing you can change in lifestyle, your diet, checking the box with a program like this that doesn't actually have true outcomes. So how do we address the fact that that's broken? Well, the good news is that the American Heart Association showed healthy food subsidies are proven to work. They have a Class 1A recommendation that is not unlike the Class 1A recommendation given to tobacco taxes. Those are the only two that have that recommendation. Further, what my experience in getting inspired to start this company was at Boston Medical Center was that if you took extra time with kids and you started by asking them, what kind of food do you like, and what kind of food totally grosses you out? And then you ask the same question to the parents, and you also ask about budget, and you also ask about what grocery stores they actually shop at and what grocery stores are nearby them, then you can actually have a fundamental impact. We dropped insulin resistance dramatically in that clinic, and we dropped BMI for the kids. And then finally, there was an article about a week and a half ago in the Wall Street Journal. The USDA reported that Americans are eating healthier, and that's a trend. It's not something that's just a fad. So you're going to see, just as Howard kind of referenced, continued themes for the consumer, and one of them is that they are actively paying more money across all income levels for healthy and for convenience. So Zipongo created MealRx as a simple, secure software as a service to help health plans and employers drive personalized engagement, productivity, and optimal health, incentive, and food costs. And we're really opening up essentially a new field of food benefits management. You can get the analogy to the pharmacy benefits management space. When that space began, Medco and others recognized, well, companies are having to pay for the drugs, and companies are also having to pay for the health outcomes on the other end. Wouldn't it be great if you could optimize the costs around the drugs with things like generics, and at the same breath, also optimize the health outcomes by driving adherence to the right drugs? Now, it sounds familiar in a sense, right? Because at the end of the day, the food benefit is one of the fastest growing benefit in HR across the country. Some companies that we work with spend 10x on food compared to what they spend on drugs. And at the same breath, driving adherence to a healthy diet, as I referenced the example before, the Mediterranean diet drops cardiovascular disease death by 30%, actually works better than many drugs. So for many employers that want to retain their talent for a long period of time, this makes a huge difference. And the savings on food costs, as well as ways in which we can optimize incentive spend, which is now skyrocketing on the wellness side, can actually deliver a year one ROI in addition to the longer term ROI that you get for changing health outcomes for real from diet. So the breakdown of the service is, number one, we give a dietary assessment, and there's a lot of marketing and a social challenge that drives very high enrollment at the beginning, with 86% enrollment when we do this in combination with biometric screening. Then that ties to a meal plan and inspiring recipes that are personalized. That then ties to action. Like Howard talked about, people want convenience, and if you don't connect action back to the personalized recommendations, just like you have on Amazon, then you've lost the consumer. You've lost your moment to help them and therefore also influence their behavior. So we connect to mobile shopping, and our app is one of the top 20 new health apps in the iTunes store, fastest growing. That then connects to discounts and rewards, which is not for everyone. Some people don't even pay attention to discounts, but other people, lower income families, middle income families, they want the convenience value proposition of having all their circulars pulled together, and Zipongo has the largest access to grocery store discounts in the country. So then we provide analytics and insights based off of that encounter. So you can start to see in the flow that when you get biomarker screening results, and then we can also pull down your dietary assessment so we know that for different segments of the population what kind of food they eat. We can then give very targeted recommendations to the individual. In this person's case, Thomas, his LDL level is very high, his BMI is elevated, and we can target fiber because we see that fiber is actually the biggest deficit in his diet. So since he's struggling with obesity and LDL, and he has low fiber, that's the place to target rather than, for example, saturated fat. So then, well, how do you tie that to action? Well, we can take that immediately into good choice meals that Thomas or his spouse can actually browse that tie directly to his interests. Now, Thomas is also vegetarian, and Thomas is also gluten-free, so that comes up immediately in the system. But take it a step further, you want to relate that back to a shopping list. So the shopping list that pops up just like your Google Hangout or Talk window in your Gmail, that actually shows you the list by meal since you're in the meal browse mode. But you can see how you can add things from the meal browse, And let's say that his spouse is actually the one that plans at home. So some of these meals have been added, and you can drag and drop them in certain days. But neither Thomas nor his wife actually have much time right now because they're both working jobs. So they really want to be given some recommendations for the whole week in the form of a meal plan. So we have this magic button that can be set and actually immediately generate meal plans for whatever days of the week that they're interested in. So it truly is a prescription for prevention, the very same that all of us have wondered, why don't we get that when we go to the doctor's office? And ostensibly, it does it better than your average dietitian. Now, your awesome dietitian, will always be an amazing asset for motivation and other things. But just like in the oncology field, where I sold my last company, Preventus, to McKesson in U.S. Oncology, our job was to help standardize care using the NCCN guidelines and predictive models that help to personalize the right chemotherapy for the right people based on their biometrics. Same thing here. You should be standardizing care, and this is the opportunity to deliver the right diet to the right people. Take it a step further, I mentioned that mobile is a huge area of growth for us, and a huge use case is finding a recipe, being inspired by that recipe, finding that at the store, and it geolocates and automatically pops up when you go to a Safeway or other grocery store. Also, the discounts in addition to the recipes pop up, and therefore you don't have to flip through the browser, or sorry, through the flyer, to then wonder which items are healthy or not healthy. It just shifts your default behavioral economics because it changes the portal through which you buy, making it very simple by reducing both your decision fatigue and it reduces the time you have to spend hunting for those discounts if you're discount sensitive. So you go from this kind of an environment to now a meal plan that's really simple and helps, again, reduce your decision fatigue, and then that can take you to something where you can just order online. And so one of the things that we've now expanded into is the delivery of groceries right off of your meal plan, and then the also take-home meal option from the employer space, where right from your meal plan you can take items home. And the kind of analytics that we deliver to the payer are extensive because we can break down by segment of population, by office, by segment of membership, how their diet is looking. But then we can correlate that to the biometrics. One of our employers, we showed that high-carb snacks that were close to people's desks were actually driving obesity. So the differentiation with data is what helps to drive personalization, and part of that differentiation is knowing what people do in their habits and their lifestyle. So putting a meal planner in front of a man who doesn't cook, to be very stereotypical, this is an actual office though, versus putting home delivery grocery in front of somebody who works a full-time job and still has to put meals on the table is a smart way to do your user experience. Unfortunately, most programs don't personalize the user experience in that way based on data. So then we have these add-ons, and a lot of companies already have investments in biometrics, incentives, in corporate cafes, and so we integrate with those different components, and then we can further personalize based on those additional data inputs. And we're integrated with many different health plans, many different lab providers, many different incentive systems around the country. And then, as I mentioned, also delivery vendors. And there is a quantified self component of this as well. Instead of having to actively track, because we get the shopping history from over 25,000 stores, and we can see everything that you plan around your meals, then we can actually start to say something and predict what you're likely eating based on what you're buying or planning. And this is actually one of our designers who has LDL go from 80 to 130. And what was really compelling is that we saw in his diet, even as healthy as he is, that his fat, sodium, cholesterol were through the roof from his receipts and his loyalty cards. And it was because he had introduced bacon in replacement of cheese and coconut oil in replacement of olive oil because he went on this low-carb paleo diet, and now he's been able to get his LDL back down. So why Zipongo? The data and the analytics alone are part of what people are looking for, combining that behavior data and food data with claims and biometrics and other sources. But we have the highest enrollment and combined with engagement in the industry, over 65% monthly active, which is much higher than other wellness programs because food is a daily activity for every single person in your population, and you can't say that about any other health behaviors. The other thing is we actually change eating behavior. 88% of people eat healthier because the system is so comprehensive and personalizes to where people are. If you care about discounts, discounts. If you don't care about discounts, then meal planning, meal browsing. You have to be comprehensive to move the needle in this area. Disease prevention, we have a study with AmeriHealth and Drexel where we drop cholesterol, fasting glucose, blood pressure, BMI. You can read about what, or hear about what Google was saying in a presentation that we had with the Partnership for Healthy America at that link there. And then ROI actually comes in interesting places. It's not just the long-term ROI related to obesity, metabolic syndrome. It's also emotional health is impacted and the spend on that. And you can optimize incentives and food costs in year one. I mean, Safeway spends $1,500 per person per year on health incentives. They realized that if they could repurpose a portion of that to the actual behavior changes like healthy eating, they would get more gain because there's only so much you can keep enrollment going up with incentives. For health plans, it's about staying engaged with healthy member base even when they're not using the healthcare system. So a lot of people don't start working with their payer until later in life, but this is a chance with food to engage people earlier in the relationship. It's engaging the engaged and keeping them healthy early. It's supporting your ASO business and remain competitive with new employer expectations about technology. And it's really also empowering providers with prescriptions for prevention that tie to convenient action, just like the experience that I had at Boston Medical Center. And really what inspired me to start this company was that I wanted to be able to take this back to primary care pediatricians and give them a tool that they could give to families to actually make a difference before kids were already obese. So wrapping up, we work with employers in the technology, energy, financial services, retail, schools, and media verticals right now. We've done some really exciting things with Aetna Care Path that you may have read about, and you're going to hear more about throughout the year. And as well, we have launched with C-Change and done a program and study with AmeriHealth, and we have some exciting new health plan relationships to announce in the coming months. The team is a great team, but we really pull from different worlds, the consumer worlds of Zynga and Kias and Stanford, mashing that up with people who've been at Catalina marketing and know the grocery space and the food industry, and then mashing that up with the pharmacy benefits management space, people like Mark Weissmiller, who helped grow Medco to what it became. And great investors who really see the future of food benefits management and tying food and healthy behaviors to get health outcomes. You can kind of think of Zipongo as the Yammer to MyFitnessPal being the Facebook, with Zipongo now being the enterprise leader with the most comprehensive food benefits management platform that exists and the highest revenue in the space for that sector right now. I think in closing, the things that make a difference here are that one, it's deeply personalized. You heard Howard talk about that, but it's not just about personalization to one element. It's 4 actual domains you have to personalize to make an impact. One is health. You got to pull in biometrics, and you can't do it at the high level. We do things like say, okay, if you're high sodium intake and you're African American versus Caucasian, and you're also obese, our system automatically sorts out, well, what's driving the hypertension? Is it the sodium intake or is it the obesity? And in many cases, you'll have an African American who has higher sodium intake and stable weight, or you might have a Caucasian who has a weight gain that's recent. And our system will automatically say, well, let's focus on sodium for you, where sodium's been the issue, and let's focus on weight gain for you, even though the same outcome is hypertension that you're trying to address. The next is habits. I talked about that earlier. If you don't meal plan, don't give them the meal planner, but if you care about discounts, put the discounts in front of them first so they adopt and engage. Food preferences and pulling the shopping history together with the dietary assessment and data from your other trackers through systems like Aetna Care Path allows us to immediately personalize the experience so you're not annoyed with the recommendations that we give. And finally, channel. With AmeriHealth, we use primarily text messaging in a Medicaid population. But at Google, we use primarily email as well as browsers and smartphones. And I think the second half, and in closing, is healthy food action. If you don't connect those personalized recommendations back to an ability to take immediate action or a chance to take a motivated individual and reset the portal through which they buy or reset their default behavioral economics, then you won't have lasting change. The data has been very clear on that for 30 years now. So in summary, if you give a man a fish and you feed him for a day, you teach a man to fish and you feed him for about a week, because tracking and tools like that, they just don't last for long-term change. But if you teach a man to set a net where the fish swim, you'll actually feed him for a lifetime. And I think we're really just trying to use moments of motivation to help people reset their environment, the buying portals and the fulfillment channels, to these healthy behavioral defaults before you get stressed again, and then you fall back to your old, less healthy ways. So if you're interested and would like to learn more, you can contact me at j@zipongo.com. And thanks for this great webinar.